Hey everyone, so let's start. Thank you. Welcome everybody to our sixth RSVNet conference. Patient Network webinar for parents and general public. I'm very happy to see that you have joined our webinar today, and our goal is to provide you, the parents and also everyone who is interested in RSV, more information about the virus, and also to inform you about the developments that are ongoing to prevent or treat RSV infection. As always, Dr. Lieke de Vrankrijker, pediatrician specialized in infectious diseases from UMC Utrecht, will give the presentation. Today, we will focus on RSV and childhood asthma prevention. And we have selected this topic because we want to know, does RSV increase the risk of asthma? And also, would preventing RSV infection decrease the risk of asthma? So it's not doing what I'm wanting. Okay. So, these points will be discussed today. So keep in mind that there's live translation. So next slide, please. Live translation available in different languages. You can easily follow the presentation of Dr. Lieke in your own language, if possible. So as you can see below in the screen, you can see the globe icon, and then you can select your preferred language. After the presentation, there is room for discussion, and we want to make sure that there is enough room for you to ask questions, but also to have discussions with us. And you can use the Q&A, so question and answer, or the chat box to write down your questions, any questions that you have. And this can be in English, but it can also be in your own language if that's more convenient for you. You can also raise your hand using the hand icon, and we can try to unmute your microphone to ask your questions. It would also be great if you could turn on your cameras during the discussion so we can see each other, and which is, of course, much nicer. After the webinar, an evaluation form will appear. And this is always very important for us because we want to know your feedback regarding the presentation, but also the process to register for the webinar, for example, or how you can find us, what could be added, or what should be, what should be maybe taken out of the webinar. All the feedback is very welcome. And we are always very happy with your advice and suggestions. So now I give the floor to Dr. Lieke. Lieke, go ahead.
So welcome again. As Leila said, today I will talk about RSV and its link to childhood asthma and whether or not we could prevent childhood asthma by preventing RSV. So what we'll talk about today, first I will give you a general introduction on RSV infection. Maybe if you've seen one of the other webinars before, you might recognize this part. And in the second part, I will talk about RSV and childhood asthma. So does RSV increase the risk of childhood asthma, and would preventing RSV decrease the risk of getting it? And then finally, we have the Q&A session where we encourage you to ask your questions. So if any questions would arise during my talk, please remember them or write them down so you can ask them later. Like Leila said, my name is Dr. Lieke. I'm a pediatrician specialized in infectious diseases in children, and I work at a large children's hospital in Utrecht, in the center of the Netherlands, the Wilhelmina Children's Hospital. I also did research on bacterial and viral interaction with RSV. I'm also a mother. These are my twins, Seth and Jonas. They were born prematurely, but they're now 5.5 years old. And as you can see, they love ice cream, as do I. So I'll start off with talking about the virus itself, RSV, respiratory syncytial virus. It is a highly contagious virus that affects the airways. And by airways, I mean the nose, the throat, and the lungs. So how does RSV spread? Because it is highly contagious. Well, as you may know, the spread is through droplets. Droplets are produced when somebody coughs or sneezes, or even when they speak. And the virus can remain on surfaces, for instance, countertops or doorknobs, and on hands and on clothing. So you can imagine it's very easy for the virus to spread when a person touches something that is contaminated, and places like childcare centers or schools are places where the virus can easily infect many children or people. So how does it work? How does RSV infect the airways? In these pictures, you will see what happens. So first, RSV attaches to cells on the surface of the airways, and then it will enter the cells. So what you see here is the virus particle, and then a cross-section of somebody's upper airways and the lower airways, which are the lungs. So once RSV attaches to the surface and enters the cells, inside the cell, the virus will replicate. And by replicating, it will lead to a disappearance of the cell walls, and we call this syncytia formation. Infected cells can also be destroyed by the body's immune system. And what happens is that the infection will lead to swelling of the airways, and also it will lead to more mucus formation. And this leads to narrowing of the airways. And you can imagine that the airways of young children are still very small, and so they are more narrow compared to adults. So they will have more severe narrowing when this happens. And when the infection goes all the way down to the lower airways, to the smallest of airways, we call that bronchiolitis. So what are the symptoms of RSV? Well, maybe you've heard that symptoms can vary from those of a common cold to difficulty breathing, so very severe symptoms. In adults, the symptoms are usually those of a common cold, like a runny nose or a sore throat. And in older adults, the symptoms can more easily lead to difficulty breathing, especially when they have underlying disease. And I will talk a bit more about that later on. In children, the symptoms also may vary. So they might just have a stuffy or runny nose or a sore throat, coughing or wheezing even, and sometimes they get a fever. When very young children get RSV, babies, the symptoms might be more severe. At first, the symptoms might just be very general or less specific, like the babies being more sleepy or more fuzzy or cranky. And sometimes they may have difficulty feeding. But when the symptoms get worse, they may lead to difficulty breathing and even to breathing pause, which we call apnea. And this is very severe if that happens. So in this short video, I will show you what happens when the RSV infection in an infant leads to a lower respiratory infection with severe bronchiolitis, as I showed you before. It is very important to know what to look for when this happens. So in the short video, I want you to look and listen for a couple of seconds to take in what you see and hear. And after that, I will talk about what it is that you can notice from the video. So were you able to notice some of the signs and the symptoms? I think it was very obvious to see that the breathing was very fast, much faster than normal. And also you could see the chest skin pulling in with every breath. So this is most visible between the ribs and sometimes also in the neck. We didn't really see very intense coughing, but sometimes you can hear that or a whistling noise while breathing. And in young babies, you can also see the head bobbing, where the head starts to move with every breath, which is a sign of difficulty breathing, because then the babies are using their neck and shoulder muscles to help them breathe because it's so difficult. I think it was also visible that the skin color was different, so it might become gray or mottled or even blue. And I think what I would like you to remember is that if any of these signs or other signs of breathing difficulties appear, it is important to immediately see a professional. A little something about the seasonality of RSV. So maybe some of you have heard that RSV outbreaks are seasonal, and this is the case in most climates, I mean temperate climates. The infections usually occur during the late autumn through early spring months. But in tropical climates, mostly they appear during the rainy season, and in some climates they appear year-round. It is quite interesting to see that after the pandemic, the pattern of RSV infections had changed. So in many countries, RSV was absent for a very long time, after which it returned when the pandemic measures were lifted, leading to very large and unusual RSV outbreaks out of season. And I think only now, only this past year, we are starting to see a more normal pattern of RSV outbreaks. So I mentioned this briefly before, but what are the risk factors that increase the risk of getting an infection with the RSV virus? So first of all, it is being born at the start of the RSV season for young children and going to daycare. And for adults, the risk of getting infected increases with getting into contact with young children. So for instance, grandparents are at risk of getting the virus from their grandchildren. But what are the risk factors of getting severe RSV infection? We know that several patients are at risk of becoming very ill with RSV. So for children, it would be those under the age of 6 months, or if they have an underlying disease, for instance, heart-lung disease, or when they are born prematurely, the risk is increased below the age of 1 year. And you can imagine that children with a weakened immune system, for instance, those who received a transplant or who underwent chemotherapy or have an immune deficiency, are at increased risk. And we also know that children with Down syndrome have a higher risk of becoming severely ill, mostly because their muscles and airways are less strong to cope with the infection. The same goes for children with neuromuscular disease. For adults, the risk factors are somewhat comparable. So adults over the age of 60 years have an increased risk, and also those with heart failure, lung disease, and similarly to children, patients with a weakened immune system, for instance, cancer patients or those with an immune deficiency, are also at increased risk. But what is the burden of RSV disease? Well, very sadly, the effects of RSV are more severe in low-income countries compared to high-income countries. And the burden of RSV worldwide is tremendous. So every year, 34 million children under 5 become infected. So this would mean 1 child every second. And sadly, death, so mortality due to RSV, is highly dependent on the setting. In high-income countries, mortality is very low, below 1%, but in low-income countries, we think it is up to 10%, so very high and very sad numbers, I think. We also know that all children will get RSV. So by the age of 3 years old, all children will have had at least one RSV infection. But we also know that not all children will become ill or will need to be hospitalized. And in this reverse triangle, you will see the percentages. So like I said, everybody will get an RSV infection, but about 10% will get an RSV lung infection, and only about 2% of children will need to be hospitalized for it. And even a smaller percentage, so 0.1%, will need to go to the intensive care unit. So how about RSV in older adults? We know from recent data that RSV is very important in those over 60 years old. So there have been some studies showing that a lot of hospitalization admissions in older adults are due to RSV. So in 2015, around 1.5 million episodes of RSV infection were reported in high-income countries. And around 15% of these led to hospital admission. So we think more and more that the burden of RSV in older adults might be even more severe than that of influenza. And if you make an estimate on hospital admissions for older adults with RSV infection, that estimate would be around 336,000. So that would mean one admission every 2 minutes. So RSV is not only important in children, it is also a very important disease in older adults. What can we do about the disease? Well, sadly, no, there is no treatment for RSV. Supportive care is the only thing that we have, and that is very important. So those with severe RSV infection, like I said before, may be admitted to a hospital, and treatments are aimed to support the patient with oxygen. And sometimes if the breathing becomes more difficult, to support them with breathing in the intensive care unit. They put them on ventilation machines. And for children especially, it might be difficult to feed. So sometimes they would need fluids through either a nasogastric tube through their nose into their stomach, or by an intravenous plug, so directly into their veins. There are several strategies for prevention of RSV infection. We've talked about this in the previous webinar. As you may know, there are very recent developments in this on this topic. We have had antibodies for babies for a while now. Antibodies for babies mean that we can directly give the antibodies to the babies who are most vulnerable. And also recently a vaccine for pregnant women has been approved. So mothers who are expecting can be vaccinated so that they can produce antibodies against the virus and transmit those to the babies, so that the newborn babies are protected against RSV infection. And very recently also a vaccine for older adults was approved, which is a similar vaccine that can be administered to older adults who are at risk of a severe RSV infection, in order to protect them from getting a severe infection. So now for the second part of our webinar, like I said before, today the topic will be RSV and childhood asthma prevention. And I will focus on the information that Tina Hartert gave during the webinar for professionals. Tina is a professor of pediatrics and also an asthma researcher at Vanderbilt University in Nashville, Tennessee, in the US. And she has done a tremendous amount of work studying asthma. And she gave a very interesting talk on, among others, a recent study that she did where she focuses on RSV as a risk factor for asthma development in children. Before I go into the highlights that she told us of her research, first, something about asthma so that we're all on the same page. What is asthma? It is one of the most important non-infectious diseases all over the world, and around 385 million people have asthma. And it is very interesting to see that the number of people with asthma has actually doubled since 1990. We know from asthma that it is a very heritable disease. So this means that people can inherit genes from their parents, and those genes can lead to asthma development. But we also know that the environment influences this further. So for instance, pollution might have an influence on actually getting asthma when you have genes that might give you a higher chance of getting it. And another thing that is important to note is that most patients have asthma symptoms before the age of 8 years. So we know that onset is before the age of 8 in about 80% of patients. So it is truly a pediatric disease. But how well do we understand asthma? I think it is important to realize that asthma is actually an umbrella term. So it is a syndrome, a set of symptoms, and the symptoms come in episodes. With asthma, the airways become inflamed and obstructed, more narrow. Maybe you remember this from the picture of the RSV infection. And when the airways become obstructed, the obstruction is reversible. So it comes and it goes. And in the picture, you see a girl taking her salbutamol puffs to reduce the obstruction and actually to reduce the squeezing of the airways, so to say. But it's important to realize that not all asthma patients are the same. There are different so-called phenotypes of asthma. For instance, there's a difference between allergic asthma, so people who have allergies and become asthmatic, and those with non-allergic asthma. And to study the factors that lead to asthma, so to look at risk factors, if you want to study if RSV is a risk factor, for instance, it is very important to acknowledge the different types of asthma. I will get back to this later. But why is RSV so important in studying asthma? As you might know from another webinar where we talked about this, many studies have looked into a possible association, a link between RSV and asthma. And in this slide, you see results from a study in which the risk of RSV infection during infancy was found to be linked with a higher risk of getting asthma. So in this graph on the horizontal axis, you see the frequency of the different factors. And on the y-axis, so the vertical axis, you see how strong the factors are. So below 0 are protective factors, like for instance, breastfeeding, and above 0 are risk factors. And you can find RSV all the way up there, showing that getting RSV or getting a severe RSV infection as a young child is an important factor associated with getting asthma. And researchers have looked at this research from the point of view, or from the question of whether there is a causal relationship. Like I said, there was a link, but does it mean that that getting RSV causes a child to get asthma? And many researchers have looked at this, and the idea that Tina also expressed is that there are genes that are associated with getting asthma, and there are genes associated with getting severe RSV, and where these two overlap, it probably represents the genes that contribute to both RSV and asthma. And we know that most of the studies have looked very extensively at the genes that are associated with asthma, but not so much at genes that are possibly associated with RSV. So when you look at where these two circles overlap, what we're looking at when we're studying RSV infection is most likely the children who are also most likely to develop asthma anyway, because of their genetic makeup. So it's very important to realize this, that in previous research, when we looked at RSV infection, it was mostly children who had a severe RSV infection. So then researchers also tried to look at the genes that are possibly associated with the risk of RSV infection. They found none. So there is no genetic risk of becoming infected with RSV. And then they also looked at the timing of birth in relation to the RSV seasonal peak. So they looked at babies who were born all throughout the year, and they wanted to see if there was an increased risk of asthma related to the timing of the birth. And they found that there was a 30% increase in asthma risk in babies who were born 4 months before the peak of the RSV season. So I think that would suggest that there is a causal relationship between RSV and asthma. But this is the study that Professor Tina also told us about, the INSPIRE trial, which is a birth cohort study. And they aimed to look at this further to see whether they could find a causal relationship. They looked at a group of babies followed from birth. This is called a birth cohort study. They included almost 2,000 children, and the children were followed for up to a year to see whether they got an RSV infection. So every 2 weeks, they would see whether the babies had an RSV infection. Those who did have an RSV infection were the exposed group, and those who didn't were the unexposed group. And now they looked at how many children had developed asthma at the age of 5. And the researchers found that at the age of 5, there was a higher risk of getting asthma when the children had an RSV infection during the first year of life. So what you see in this graph is the severity of asthma. So on the horizontal axis, you will see the severity of the RSV infection that they had, and on the y-axis, so the vertical axis, you will see the probability of getting asthma. And you see that with the severity of the RSV infection, the risk of asthma increased. And the researchers estimated that if children did not get asthma as an infant, so before the age of 1 year, they had a 15% lower chance of asthma. So very important, this study shows a direct link between getting RSV as a young infant and getting childhood asthma at the age of 5. And also, when they looked at the two phenotypes, the two types of asthma, they found that the strongest link was between RSV and non-atopic, so non-allergic asthma. And then finally, if RSV would indeed cause asthma, as this study suggests, how would that work? There are several ways in which RSV could lead to asthma. So in this picture, you will see a depiction of how RSV could lead to changes in the microbiome. Microbiome is all the bacteria that live in our airways. So it is possible that the virus disturbs the balance of the bacteria. Usually there's a balance between good and bad bacteria, and the virus might influence that. And also RSV could lead to changes in the development of the inner lining of the airways, which is called the epithelium. This is what would happen in an infant. Furthermore, there's also evidence to suggest that RSV infection would lead to changes in the metabolism of the cells of the airways. So it would change the way that the cells of the airways work. And this might also lead to an increased risk of getting asthma. And then finally, the changes in the epithelium, so in the inner lining of the airways, which forms a barrier, more or less, might become dysfunctional. And you can imagine if the barrier isn't working correctly, it could make children much more susceptible to, for instance, allergens, as you see here. And this, of course, might lead to asthma. So these are different ways in which during infancy and childhood, an RSV infection might predispose children, make them more likely to develop childhood asthma. So what can we conclude from this? What have we learned? Well, we have seen from research that a delay of RSV infection in early life will lower the risk of asthma. And we also know that an infant RSV infection may contribute to asthma development in different ways. So preventing or delaying infant RSV in the first year of life may decrease early childhood airway disease. And I think studying the prevention or the delay of RSV infection in early life may confirm whether this causal relationship that we think that is there is actually there. And this would help us to think about strategies to prevent asthma. I, for one, think it would be very interesting to see what happens with all the upcoming prevention strategies for RSV that I told you about. Will they change the prevalence of asthma, and will they indeed confirm what this important study has shown? That concludes this part of the webinar. Thanks for your attention so far, and we go back to you, Leila.
Yes, thank you very much, Lieke. I think it's a very interesting topic, right? So, so not only talking about RSV, but also about asthma and the relationship between these two. I'm not sure if there are, I can't see if there are any questions. So I'm not sure if from your side you can see, or maybe Liz can see if there are any questions. Please put your questions in the chat, or in the chat, or otherwise, just let us know if you have any questions, and then we can unmute your microphone. So, Lieke, I do have one question from my side. So I was actually indeed thinking of the fact that so there's new vaccines indeed coming to the markets, right? So vaccines for kids, and also vaccines for during pregnancy. So we know that this, we are assuming, or we know that these vaccines, they will not prevent transmission, so that that it's not going from one person to another person, the virus, but it is hopefully going to help that the disease severity is less. So I would say then it's actually, do you expect then that we will see immediately a lower number of, let's say, asthma cases in children? Or does it have time? Does it need time? And then we go to Monica, who has the next question.
Yeah, I think this is one of the most important questions, Leila. What I find very interesting about this trial is that they have shown a direct link between any RSV infection and developing asthma, whereas most previous studies only looked at, which is of course very understandable, only looked at severe RSV infections.
Yes.
So I think that only shows that children who have a genetic makeup more likely to get asthma are also maybe more likely to have severe RSV infection. But with this study, they've shown that getting infected, that in itself might even lead to a higher chance of asthma. Now, we know that these prevention products, so the vaccines that you mentioned, are effective in preventing severe RSV infections. So they protect children against becoming severely ill with the virus. They do not protect them from getting infected at all. At least that's not the aim. That's not the main aim of the vaccines. So I think in order to see whether there is an effect, you will need a lot of time and a lot of patience to say something about that. Yes.
Yeah. Interesting. Monica, go ahead. You can also turn on your camera if you,
Hello, yes, one question to the doctor, because we are a parent association, and we would like to know how we can support or motivate the other parents that has, premature babies, for example, how to prevent or to support the babies, apart of the vaccine, of course.
Yes,
During the winter time or before the winter time.
yes. Thanks, Monica. That is a very important question, and we get asked that a lot. And I think what you're saying is right. We can definitely talk to parents to help them reduce the risk of their children getting an RSV infection, because I think we can never fully prevent those young vulnerable babies from getting an RSV infection. Because, for instance, when you have siblings at home or other people, even people without symptoms might have the infection and be infectious. So I think the most important things to do is that if you have a vulnerable baby and it is the RSV season, if there are any people who are visiting who have signs of a respiratory infection, it is best to see if they can stay away, and if they have to visit, then they have to wash their hands and if possible not get too close to the babies. So all of these measures, I think, are aimed at reducing the risk. But I think it's important to stress to parents that it is not their fault if their child would get infected, because it's virtually impossible to protect them from every virus. So those are the measures that we usually advise parents to take into account to reduce the risk.
Okay, thank you so much.
Thanks for your question. I'm hearing there's a question in the chat from...
Yes, I'm sorry, I was on mute. I was talking already. Yes, indeed, there's a question from Brenda. Having had a severe RSV infection as a baby, my child still requires inhalers. Does this imply the presence of asthma or just a significant risk of developing the asthma? So so it actually more, when can you say it's asthma, or is it the long-term effects of the RSV infection?
Yeah, that's the other important question, I think. Thanks very much, Brenda. So what this study has shown is that at the age of 5, more children had developed asthma, childhood asthma, if they had an RSV infection during the first year of life. I think to actually diagnose asthma, you would need the child to be at least 5 years old, because then you can do a lung function test to actually say that it is asthma. So you look at whether or not the obstruction in the lungs is reversible, like I said. But I do think that if children after their RSV infection have recurrent episodes of wheezing, like you said, that it does mean that the risk of getting asthma at the age of 5 years old, so going on to develop asthma, is higher. So I think that if children get an RSV infection in infancy and they go on to never develop any wheezing episodes after that, then I think their chances of getting asthma are much lower. So I cannot say, of course, for sure regarding your child. And it also depends on the age of your child right now. But if the wheezing episodes keep returning as you get closer to the age of 5, it is more likely that they might develop asthma.
Yeah, indeed. Thank you. So we have also, next question is from Esther. with the coming of vaccinations against RSV, is it expected that the number of children with asthma will decrease after RSV infection?
Yeah, so that's also similar to the question Leila asked. I think it will be very interesting to see and I think we will hopefully see maybe a small effect after several years. The problem with asthma is that it is a very multifactorial disease, right? So of course, RSV, like in the graph I showed you, is a very strong factor that will increase the risk of getting it. But there are so many other factors that are also of influence that they might dilute the effect of RSV and preventing RSV. So I think that would preclude any big results to emerge within 1 or 2 years after we start vaccinating children.
Yes, thank you. So like one other question. So if we are going now to vaccinate the babies against RSV, right? Maybe it's not really related to asthma, but isn't it just a way we have seen it, during the COVID, that we had kids who didn't get, RSV in their first season because there was no transmission, but then later. So isn't it just delaying the disease? And if we are going to delay it, does it mean that the disease will be more severe or less severe? What do you think?
Yeah, that's also a very good question, because I think you're also referring to the post-pandemic RSV peaks, where we also saw more severe RSV disease in those children who got RSV, even though they were a bit older.
Exactly.
Yeah, so I think we know that young age is the most important risk factor of getting a severe RSV infection. So that determines how severe the infection is. And we know that with decreasing age, the effects of RSV will be less. So I think what could possibly happen is if we sort of delay the first RSV infection and it will lead to an infection later in life, the risks of getting severe RSV are lower in general. But I also think that if a lot of children get RSV at a later age, there will always be some children who do get a severe infection. So it doesn't mean that we will only see very mild RSV infection. Yeah. So I think the severe infections will be less, the complications will be less because the children will be older, but it does not mean that severe RSV infections will no longer occur.
Yeah, no. So you would say indeed that the children are, who are older, a bit older, let's say, so after their first year or so, their immune system is much more developed, and their lungs are developed and stronger, so they would be more capable of managing the disease.
Yeah, I think so.
Indeed.
Yeah, I hope so. And that's also what Professor Hartert showed in the graph, right? If you have RSV infection in infancy, where the epithelial lining and the airways are still developing, that if something goes wrong during that time, it will have its ramifications
on the asthma. Yeah, okay. So there's also another question, and it says, does giving antibiotics affect the development of asthma?
Yeah, that's also an interesting question. I also showed in the graph that one of the ideas is that RSV has an effect on the microbiome in the airways. And the microbiome is just all the bacteria that are in our airways. So we know from several of the studies that giving antibiotics also changes the microbiome, and sometimes even for a long time. So it might be that there is an influence of antibiotics on the chances, the risks of getting asthma. That's also a risk factor.
Yeah, and I think here in the question, it's actually more in general, right? So it's not antibiotics during the first year, or but if that's indeed in the first year, then it has also the effect on the epithelial cell or microbiome or everything. Okay. Yeah. So I don't see any other questions. I'm not sure if there are anybody who has any questions related to RSV or to your child or anything. If not, then I think we can conclude this webinar, Lieke. So thanks to the patient network and to Promise, RSVNet, everyone who was involved in organizing this webinar. The replay will be available on RSVNet website in a few days, so you can also watch it back. And there will be also a short questionnaire to hear your thoughts on the webinar. Thank you, Lieke, for trying to explain this in a very simple way. So it was really nice, and I enjoyed it. So thank you, and have a great day, everyone.
Bye. Thanks.
Bye.